Hello, everyone, or whoever watches this in this week's discussion board post. This week, I'll be talking about rotator cuff tendonitis for my musculoskeletal disease. Another name for rotator cuff tendonitis is swimmer's shoulder, pitcher's shoulder, and tennis shoulder. To begin, some other terms needed to understand, what this is are a tendon. A tendon is a type of fibrous tissue that connects muscles to bones. The synovium is a sheath covering tendons which produces synovial fluid to keep tendons lubricated. And if you injure your shoulder really bad, you can damage the synovium and cause it to malfunction. If it malfunctions, it will not create this synovial fluid and the tendons will not be lubricated. And when the tendons are not lubricated, they can become inflamed and swollen, and that is called tendonitis. So, more of a visual description. So, looking at the left picture, there are four tendons in the shoulder. They cover the scapula, which is also known as the shoulder blade, and that arm bone, the humerus. So the four tendons are the supraspinatus tendon, the subscapularis tendon, the infraspinatus tendon, and the teres minor tendon. And all four of those tendons have a correlating muscle with the same name. Next, some symptoms of tendonitis are mostly, just pain in the shoulder is what people describe it, but there can be swelling around the shoulder. When people have, rotator cuff tendonitis, they can have trouble raising and lowering the arm. It affects their range of motion. Sometimes, if they raise their arm, they can feel a clicking noise, or they can hear a clicking noise, and they just mostly just have shoulder stiffness is the best way to describe it. It's uncomfortable to sleep on, tough to do everyday activities. People don't realize how much they use their shoulders until they lose the ability to use their shoulders. And that's why this can be disabling in some people if it gets really bad. Next, some risk factors. We'll start with individual risk factors. So the first one is age. Although this is prevalent in people of all ages, it is more prevalent in people over 40 years old. And really, sometimes there's no known cause of why someone develops it. It can really just be the wear and tear of, life. And so that's why the more years you put on, uh, the more wear and tear you get on your shoulder, which can cause tendonitis. And next is genetics. So some families have histories of rotator cuff problems. I know my family does have a history of rotator cuff problems. I do myself, and so that can be a factor. Next is sleeping positions. So if someone has a pattern of just sleeping on their shoulder every single night, that pressure on your shoulder night after night can cause that synovium to malfunction and those tendons not to get lubricated, and then they flare up, and now you're going to the doctor and getting diagnosed with rotator cuff tendonitis. Next, diabetes. So diabetes can cause rotator cuff tendonitis because a buildup in the shoulder can affect the blood flow from getting to the shoulder and the tendon not being able to get repaired or repair itself, which can cause tendonitis. And lastly is weight. So people who have high blood pressure, even just a high body mass index, can be at higher risk of developing rotator cuff problems. Next, we'll move on to workplace risk factors. So just repetitive shoulder motions. So if someone's, lifting above their head 1,000 times a day, that can cause some serious wear and tear on the shoulder and that synovium to get damaged. Next is just reaching over your head, so we kind of covered that. Um, Frequent forceful motion. So if we look at this dude in the yellow hard hat to the right, it looks like he is hammering in some concrete tile. So if he's just, hammering 8 hours a day and using that same arm and doing those forceful motions, all day, every day, it can cause some serious wear and tear in the shoulder. It can damage the shoulder, and when that shoulder gets damaged, it can cause that synovium to malfunction. Next is heavy lifting, and lastly is just poor posture. So if someone's working on their knees a lot, their back isn't straight, their shoulders aren't upright, it can cause them to put extra pressure on those shoulders, and that can cause the synoviums to get hurt or damaged. And this is also prevalent, in office workers if they're sitting at their desk all day, every day with poor posture, puts too much pressure on those shoulders, and can cause you to get rotator cuff tendonitis. Next, so is just preventions and treatment. So it's really, if you go to the doctor and complain that you're having shoulder pain and they diagnose you with, rotator cuff tendonitis, they're really just going to recommend a lot of home remedies. So they're going to recommend that you ice that affected area every 15 minutes or as much as you can, but don't over ice. Don't do, periods longer than 15 to 20 minutes. They're going to recommend that you take some anti-inflammatory medicines, so ibuprofen. Read the directions on the back of the bottle or listen to your doctor. Rest that affected shoulder as much as you can. If it's still doing all those things that gave it, rotator cuff tendonitis in the first place, that MSD is not going to heal and the pain is not going to go away. Refrain from repetitive activity. Do a shoulder exercise program. So I posted a few exercises right over here in these white pictures. So just reach across your body, keep that shoulder stretched, work on your range of motion, do some band work, put your arms behind your back and pull them apart, do shoulder strengthening exercises. These can all be preventative maintenance on your shoulder. And lastly, this is rare, but in some really serious cases, you may need surgical repair. This is like almost never used. Like even when tendons are completely torn or they're starting to fray and they get really damaged, these at-home remedies are still the recommended treatment. And then some cases, instead of surgery, you could get a steroid injection or a cortisone shot in that shoulder to help out with the inflammation and help out with the pain. That's really all I have. I'm looking forward to hearing you guys' feedback, and thank you.